I'm Thomas Baldrick here at the ISTH conference in Toronto, here for Thrombosis.TV, and joining us now is Dr. Kurt Mahan from Presbyterian Healthcare Services in Albuquerque, New Mexico. Thank you, sir, for your time and chatting with us.
Thank you for having me.
Let's talk about your study and its findings.
This study is a large retrospective database study, and it's in specifically acutely ill hospitalized medical patients, and we looked at post-discharge thromboprophylaxis in this population. Mortality, risk factors for mortality in this database study.
Let's talk about the unique aspects that you've found so far.
So we did go to the detail of cause of death in a large pool of, we looked at 32 million patients initially, and then we narrowed it down to approximately 12,000 patients that died, and looked at risk factors for dying. And risk factors for mortality included things such as elderly, age, and longer length of stay, and being sick as measured by Dio-Charlson index. So not surprising that sicker patients are more apt to have mortality, but those are some of the risk factors for mortality. We also noted that antiplatelet and anticoagulant omission were a risk factor for mortality.
Other than sick, were there any particular patient types that were at higher risk of death?
There was a trend of cancer patients or those with benign and malignant neoplasms to also be at high risk for death, and that was a large pool of our database. So clearly it's a population, I think some of the takeaways that we need to continue to study more. There's quite a bit more research that needs to occur in this patient population.
What is the optimal duration of thromboprophylaxis in these patients?
It's still yet to be determined. The APEX study and the Mariner study are two ongoing phase 3 studies with rivaroxaban and also betrixaban in the APEX study, and they're both studying post-discharge prophylaxis. Actually, the APEX is starting during admission, and then the Xarelto study, Mariner study, is studying 45 days post-discharge. In our retrospective database study, the Kaplan Meier curves for death separated strongly between 15 and 30 days, and still were strongly divergent at 45 days. So I would suggest that data leans towards anywhere between 30 and 45 days, which is being studied currently in those two prospective randomized trials.
You bring up APEX and Mariner. How does your particular research relate to those?
Well, I think it's the question of whether VTE prevention actually affects mortality has really gone back and forth, and studies such as Gardlin and Halkin and also Dentali did a large analysis that suggested that fatal PE may be decreased with VTE prevention. And so the question's still really out there: does VTE preventative strategies as far as thromboprophylaxis with drugs, does that reduce all-cause mortality? And does it reduce post-discharge VTE as well? So I think really next steps, we need to continue to do more research on risk stratification. We've looked at a lot of different risk factors in our study for death, and also risk factors in the antiplatelet and anticoagulant model. And I think we still need to continue to figure out how best to risk stratify these patients at the hospital level and post-discharge.
Thank you again. We appreciate your time. Wish you the best of luck in this continuing research of yours.
Okay, thank you very much. Appreciate it.